Adelaide Primary Health Network, one of 31 PHNs across Australia, works to improve the health and service needs of about 1.2 million people living across the metropolitan region. Of all the health services and activities they commission, around half respond directly to local mental health needs. One of these services is unique to South Australia.
The Lived Experience Telephone Support Service, or LETS, is a peer-led telephone service for people with mental health problems and their carers who can receive real-time information, navigation and support from people who have lived experience of mental health problems.
Welcome to the Lived Experience Telephone Support Service. You're speaking to Cam.
Adelaide PHN says LETS offers real-time solutions from people who have walked the journey themselves.
Yeah, look, my GP told me to call.
What was the actual catalyst for commissioning LETS?
The LETS service is part of a broader hospital avoidance strategy. People who present to emergency departments with mental health and behavioural problems, a fair proportion of those are there because they're in situational crisis, and what they actually need is to be listened to and understood first and foremost, but also be offered practical support that's going to work for them, and then other types of interventions that they can access in the future.
I spent 6 years in the army, so having time away from friends and family supports in a pretty stressful environment, that's something. I had a lot of anxiety and depression towards leaving the army after I had a lot of my physical injuries.
How do you think your lived experience helps support callers who come through here to LETS?
I suppose the main reason that I kind of got into mental health is that I had a friend suicide in the army and another friend attempt several times, and when he attempted, he came to me for that. I think generally when people call and they know that I have lived experience, and like everyone at its service does, they just feel more assured, like we understand what they're saying, and they notice the difference between us and other services. I don't know how many times they've said, "Oh, I just feel like you get it."
LETS offers an anonymous service, either by phone or web chat, and there's no time limit on conversations.
The LETS worker will provide support through information. If someone's had a bad day, they just need to talk to someone. They work in those lonely after hours period when people don't have support around them, they don't have access to their psychologist or their GP.
Why would you say it's important to have a service like LETS?
LETS is one of the suite of programs that links to Wellbeing managers, which is funded by the PHN. The beauty of LETS is it works within a step care model of service, so the ability for a person to be able to tell their story once and then if they need to be stepped up or stepped down depending on whether their needs increase or decrease, they only have to tell their story once and that person can then move through the system.
LETS has been in operation for a year and to date has taken more than 5,500 calls. There's clearly a need for this one-of-a-kind service, filling a niche for non-crisis mental health support. The reaction so far has been overwhelmingly positive.
The really good feedback is, I had one the other day that you're a legend, which was pretty funny. But the feedback is honestly that, thank you so much. I don't know what I would have done tonight. Or I feel so much better having spoken to you. It's really good to get it off my chest.
Adelaide PHN says most importantly, LETS offers hope from people who are living proof themselves that recovery from mental health problems is possible.